Hi. If somebody is having a chest pain or heart attack, what will you do? Rush to the hospital? You are tired of hearing the same thing, rush to the hospital. We are brainwashed for years, rush to the hospital. But wait, small efforts can make a big difference. The idea of my today's presentation is to make you aware of what you can do wherever you are, what actions to do, what medicines you can use on an emergency basis. This may reduce emergency of the situation. All these may not take much time. Even after doing this, if you are not finding improvement, yes, you can go to the hospital, but continue these procedures and medication on the way to the hospital also. These efforts have the capacity to halt or may end the crisis if you really learn and make an effort. What you can do at home with energy channels and different medicines. If you are skeptical about this, about the energy channels, please understand there are about 72,000 nadis in your body. Nadi is a Sanskrit term, means channels or meridians. Somehow modern day medicine doctors are ignorant of these meridians or energy pathways. But you ask any yoga master or guru who is self-realized or enlightened, or a Tao master or a Qigong master, or ask an acupuncturist whose science is more than 5,000 years old. Everybody will say that the energy in the body flows through these meridians. The energy means the prana, the life force, the chi, which any practitioner of Ayurveda, Siddha or homeopathy practitioners understand. Of all these, I know about homeopathy, acupuncture and yoga. But let me talk of only homeopathy and acupuncture today. Worldwide, over 200 million people use homeopathy on a regular basis. India leads in terms of number of people using homeopathy with 100 million people, that is 10 crores. 3 years back, I always used to carry one medicine known as sorbitrate, hoping that if something happens, some chest pain comes, I can use it on emergency basis. But after seeing experience of one of my patient who was 43-year-old female, diabetic, she had chest pain. She went to the cardiologist who prescribed her Angiplat 2.5 mg, something like sorbitrate, nitroglycerin, and Prolomet 25 mg. After taking those medicines, the chest pain which she was having, it became worse, particularly heart pain radiating to the arm, and she was unable to walk because of the shortness of the breath. After seeing this, I asked her to stop the medicine. Immediately, significantly, the pain came down, and I gave another 2 homeopathy medicines known as R2 and R3, and the pain, all the symptoms have totally disappeared. And from that day, I carry 3 basic homeopathy medicines wherever I go, in case if I need. Myself, Dr. Sudhakar Reddy Tirupati, pediatrician with more than 30 years of experience in modern medicine and 14 years of experience in homeopathy, which I call spiritual medicine, and some experience in acupuncture and Kundalini yoga. My mail ID, try incurable, you may find it interesting. It doesn't mean that I cure every incurable disease, no, definitely not. But thanks to the present health situation of the people, where the disease is mostly managed, rarely cured, I am able to succeed in at least 7 or 8 out of 10 people. So let us see the commonly advised medicines. The problem with the sorbitrate is, particularly it cannot be given when there is low blood pressure and there is congestive heart failure or heart failure, and usually heart attack is associated with these symptoms. And see the side effects on the left side may not be seen in every patient, but these are the reported side effects like irregular heartbeat, low blood pressure, dizziness, nausea or vomiting, difficulty in the breathing, weakness. And all these symptoms are maybe the presenting symptoms of the heart attack. So it may complicate the pictures. Along with the chest pain, which he already has, one more pain may be added, that is headache, which is very common side effect of the sorbitrate. Aspirin may be a better choice, better option if it is not contraindicated, particularly person who is older than 16 years. Angiplat also same, some nitroglycerin, something like sorbitol only. You can see all the side effects, similar side effects. Why I prefer to give homeopathic remedy? Because of mainly two reasons. No side effects, will not confuse or complicate. Second thing is, usually they address the exact symptoms which are usual. The principle of homeopathy is symptoms of matching with the patient with the matching symptoms of the remedy. So, they treat the exact symptoms which are usual symptoms of heart disease, like squeezed or compression or oppression, pain after exertion, oppressed breathing from the weight on the chest, irregular heartbeat and palpitations, conduction disturbances, circulatory failure and pain extending down the left arm. I suggest particularly this medicine known as aconite in the potency of 10 m, particularly because these are the common symptoms where a heart attack patient will have. If there is fear and anxiety, and if there is fear of death, that is the number one indication. Number two is tension. The tension may be there at the emotional level or mental level, or tension may be there in the blood vessels or arteries. You know, heart attack is because of the tension in the arteries or block in the arteries, or tension in the involuntary muscles. Heart attack is the damage to the muscles involved. So, wherever there is tension, this medicine works wonderfully, and this is one of the great pain remedy. So, the dose is 10 m, the potency is 10 m, single dose, that is 6 pills, or if it comes in dilution, just give 4 drops, do not repeat it, only once. The usual medicine which I carry with me wherever I go are these three, R2, R55 and R67. R2 is the basic drug, 55 and 67 better to use only if you have confirmed chest pain, but even if you use otherwise also nothing will happen, there are no side effects for these medicines. This is just to tell you what is the composition of R2, one of the basic medicine, and you see, don't worry about the names of the medicine, just see the red colored, the symptoms which are the most prominent symptoms of heart attack. If the symptom is exactly matching, you can use the higher potency also, 30 Ch, it can be repeated also. So, common symptoms like as if heart is squeezed or had got a shock, as if the heart compressed violently hindering respiration, oppressed breathing from a weight on the chest. This is the classical description of the heart attack pain. And if there is a sensation as if the heart is going to stop if moved, shifting pains in the heart, oppression, must deep breather. And if the heart attack follows some depressing incident or some mental shock, and if there is angina like symptoms like gasping for breath, particularly after walking or after doing any exercise, going upstairs, if it is associated with cyanosis or bluish discoloration of the mouth and lips, this medicine works wonderfully, Laros herasus. And one of the main cause of death in heart attack is the conduction disturbance. There are medicines exactly matching those symptoms, myocardial weakness and conduction disturbance. And if there is a sensation as if heart squeezed with a hand, as if crushed, pain extending down the left arm, pulse weak, irregular, trembling or strong visible pulsations. So, these are some of the common symptoms of heart attack we have come across, and there are exactly the medicines which can rectify those problems. So, what exactly you can do when somebody has heart attack? As far as possible, ask the patient not to be panic, and if the patient is afraid too much, if he is having a fear of death, definitely give aconite 10 m, as I already told you. And following these three medicines, Reykjavik 2, which is otherwise known as heart efficiency drops, basic medicine. And because heart attack involves the injury to the muscles, R55 takes care of that. R67, particularly if there is circulatory debility or failure, because usually heart attack associated with the cardiogenic shock or circulatory failure. Give these three medicine in alteration depending on the situation, either every 15 minutes or half an hour, 1 hour, 2 hours, depending on the severity, 10 to 15 drops. So, this is about the medicines what you can use wherever you are or at home. So, I suggest you to keep these medicines at home. Then other thing we can try is, which is rarely discussed, is how we can use acupressure in or acupuncture in heart attacks. Just these are the main 2 points. Don't worry about the other name. Just remember these two, H9 and P4. Particularly useful in acute heart disease or angina pectoris. So this is the time tested medicine which stood test of time for more than 5,000 years. And this is the image of 4,500-year-old. This image was there on the tomb of a king's physician of ancient Egypt, just to show that he was doing foot reflexology, just to show that reflexology was there from since 4,500 years. If you are still skeptical, do a small exercise. You press along the medial border of the foot. So this is just show you how foot reflexology works. Actually our spine is represented here on the medial aspect of the feet. This corresponds to cervical spine. If somebody is having cervical spondylosis, this part will be painful. So come back slowly down. This is along the edge of the bone. Then this area is lumbar. If there is some lumbago or back problem, lower back, this area becomes tender or sore to touch. See, in different people you will clearly understand this. Come lower down, then comes the sacral area. So this is how our spine is represented on the medial side of the feet, and this lumbar almost corresponds with the arch of the feet. And other thing I want you to check is, if you have some women in your house lactating, feeding the baby, then this is the area of breast. So see, if she is actively lactating, this area will touch the feet of the woman. This area will be sensitive and sore to touch. And if you do everyday slight pressure on this area, milk output will definitely increase. So for those who are skeptical about the foot reflexology, they can check these points. Spine here and breast, of course, in a female. In a woman, this is more prominent. Then I want you to understand one basic measurement in acupuncture known as kun. This also you can have a practical demonstration. Kun means it is the measurement of the patient, not yours. Whoever needs the treatment, you have to take the measurement of that person. One kun is, you take the distance between the two creases of the middle finger. So today I am going to show you one basic measurement in acupuncture, that is kun. This is my middle finger. Measure the distance between the two creases of the joints. It is from 2 to 4 centimeters, that is 2 centimeters. Other place where we can measure the distance is width of the thumb. At the joint you can measure, again here also it is showing 2 to 4 centimeters. Between 2 to 4 centimeters, that means 2 centimeters. So which points to use in acute heart attack? Basically there are 2 points, H9 and P4, but because of these points are very close near inner elbow, they can be used at the elbow also, these P3 and H3. All these 3 are useful in emergency, particularly when there is acute heart attack, acute heart disease and angina pectoris. When you are doubtful about the heart attack, when it is not severe or when it is in a remission, then you can try this point known as P6. And also you can use the palm and sole reflexology. This is one of the very important point known as H9 point, Jingwell point, very useful in acute emergencies. You have to choose the point. This is your little finger at the base of the nail on the radial side, the side towards your ring finger. Point 1 kun above the base of the nail is the point of H9. So this H9 is a Jingwell point, means the point at which chi emanates or exits. Most distal points on any channel are the strongest to clear excess and heat from the opposite end of the channel, used for the clearing of heat, restoring consciousness and rescuing collapse. So, H9 is particularly useful when there is heart pain and chest pain particularly on the lateral costal region. My little finger and you choose the base of the nail. There are two sides. One is the outer, this side we call ulnar side, and this side we call radial side. The side which is towards the ring finger we have to take. Here 0.1 kun from the base of the nail on the radial side. So, here you can see my kun is about 2 centimeters. So, 0.1 kun is 2 millimeters. From the base of the nail you can see the point, that is H9, that is the point where we have to bleed in case of heart attack. So, this is the point H9, this should be bled. So, you can see blood is coming from my H9 point. So, this can be bled in case of acute emergencies, acute heart attack. This almost rescues the patient. This is just to show that how the heart meridian is there. So, starting from axilla and ending at the tip of the little finger on the radial side. Every specialist trained in modern medicine says that heart pain extends to jaw, neck, arms, back and upper abdomen. But why they spread there, nobody can give conclusive evidence except the acupuncture. You can see in this picture on the left side how the heart pain goes to the jaws and neck, how it goes to the upper abdomen and how it goes to the back also. Back it goes with the help of the couple meridian known as small intestine meridian. So, because of all these meridians only, what they are typically called symptoms of heart attack, this is the basis why the pain goes to different places. This is again to explain the why the heart pain goes to the left arm and why it goes to the upper abdomen. Then this is about the P4, second point useful for acute emergencies. This point is there. This is proximal to the midpoint of the wrist crease between two tendons. So, I am demonstrating pericardial meridian. If you take the distance from the wrist crease to the elbow crease, you can locate the 3 points. So, from the wrist crease about 2 kun is P6. You remember my size is 1 kun is 2 centimeters. So, here it is 4 centimeters, means that is 2 kun, that is P6. Then 5 kun from the wrist crease to in the same direction, 5 kun from the wrist crease is P4. And from wrist crease to elbow crease, it is approximately 12 kun. So, my size is 1 kun is 2 centimeters. So, 12 kun means 24 centimeters, is exactly 24 centimeters. And here this is the point of P3. So, the P3 you can locate it, this is the tendon of biceps, just inside of that, actually this is the point, inside of the tendon is P3. So, P3, P4 and P6. The P4 point is particularly useful when the pain radiates to neck, back or left arm or be accompanied by vomiting. So, these are the points where particularly they are useful in the acute emergencies or when there is a heart attack. Sometimes we come across some people, somebody suddenly falls down on some place, he becomes unconscious, he goes into coma, what we call cardiogenic shock. What you will do that time? So, there is one important point known as DU26. This is the philtrum at the junction of the upper 1/3 and lower 2/3 of the philtrum is the location of this point known as DU26. This is again a Jingwell point for acute emergencies like fainting, shock including cardiac arrest, coma, fits, heat stroke or even hysterical attack. You have to just apply the firm nail pressure on that point here. So, this is the location of P6 about 2 kun proximal to the wrist crease between the two tendons. Here you can see two tendons, 2 kun proximal. 2 kun is equivalent to 3 fingers. So, elbow is the very important place where the 3 points are there, pericardium 3, heart 3 and LU 5. The lung and heart are mutually connected, and when there is lung heat, it is usually enters the heart, there will be agitation and heat condenses and blood causing the stasis, there will be heart pain. Many people die unnecessarily either at home or on the way to hospital because people are ignorant of a simple technique known as elbow slapping. Small efforts make a big difference. Because I know acupuncture, I prefer to use 2 points related to heart and pericardium, H3 and P3, and 1 point of lung channel LU5, because they are all located in a single line in front of elbow. And we can simultaneously stimulate the heart and lungs, and we can train even laypersons very easily this technique. I want to also utilize DU26 if required in an unconscious patient. Now have a look at the video which follows and practically demonstrates how this technique helped in the recovery of an unconscious patient from a heart attack in Singapore.
It was a typical night at the movie theater in Singapore, until suddenly, a man in the audience suffered a heart attack. Panic set in as the audience watched the man struggle for his life. Doctors and assistants rushed to the scene, desperately trying to save him. And then, a miracle happened. The 2 medical professionals quickly sprang into action, slapping the man's inner elbow. Within just 2 minutes, the man had recovered. This amazing technique is captured in this video and serves as a critical lesson in emergency situations. Heart attacks can strike suddenly and leave people feeling helpless. Many people die on their way to the hospital, but you can help save a life. By slapping the inner elbow of the left hand, you can stimulate the 3 acupressure points around the heart and lungs. This helps to accelerate blood circulation, make a person feel warm, and stop sweating. This simple technique can increase body temperature, prevent the accumulation of blood clots, and facilitate blood circulation. It's important to remember to take the person to the hospital immediately after applying this method. But it's not just for emergencies. By touching the inside of the left elbow every day, you can prevent heart disease and reduce the incidence of heart attacks. Small efforts can make a big difference. Share this vital information with all your friends and family. Remember, small actions can save lives.
So, lastly, we can also use the sole reflexology or form reflexology. See in the picture on the right side, this is the sole of the left foot. You can see a purple line that indicates the diaphragm level. Above that there is a brown area that represents the heart area. In the second picture you can see between the 2 thumbs, that is where the heart is located. So if there is some problem with the heart, if there is some heart attack, usually this area becomes sensitive. This is one way of knowing the heart attack. And in the left side picture, in the diagrammatic picture, you can see again the diaphragm, the purple line. Below that is the red area indicating the stomach and pancreas. You should know this also because sometimes the problems of the stomach and pancreas also they present as symptoms of heart attack. So far left side you can see exactly where the stomach is located. In this figures you can actually see both heart area and also stomach and pancreas area. Heart area is above the diaphragm, stomach and pancreas area is between the diaphragm area and the waistline. Sometimes you can use even palm reflexology also, but sole is more convenient, particularly left sole or left palm, because in the palm the diaphragm level is quite below at the level of base of the thumb, but here clearly you can see the heart area. Finally, I have to make a disclaimer. I am not against going to the hospital or modern medicine, but first try this at home. If it's still you are not improving, then go to the hospital. I acknowledge the importance of what we call ABC, maintaining airway, pulse and level of response, and CPR in an unconscious patient. While I will definitely use this point DU26 as an emergency point in coma or cardiogenic shock. Thus, various spiritual practices, energy pathways, meridians in the body are only experiential. They cannot be seen with the eye. Particularly because I am an acupuncturist, I know when I put a needle at one particular point of the meridian, if the energy, once the needle, after putting the needle, if the energy block is removed, immediately patient says, see, the electrical energy is going like this. He exactly shows the direction of the meridian. And this presentation is mainly for awareness and educational purposes only. If anyone has chest pain, consult a medical professional. But before that, these practices and medicines can be tried, which may halt or end the crisis. Finally, please consider subscribing and sharing if you are convinced that this is useful and truthful, different from the routine. And if it is useful to you, your family, your relation or your circle of influence, and if you are interested in such videos, please do subscribe. Thank you for sparing time, and thank you for seeing. Thank you very much. See you soon again.